Stretched or torn earlobes are a very common problem. The first step in repairing earlobes is to mark the area. Here we are numbing the area with a local anesthetic so the patient does not feel anything during the procedure. Here I am cutting out the torn part of the earlobe so we can begin stitching it back together again. When we stitch the earlobe back together, we use two different layers. A resorbable layer that will go away by itself, and a layer on the top which we will remove in about 10 days. Here is the final result. Here are before and after photos.